Good morning. Welcome to Life to the Max. Yes, and of course, if you're watching this not in the morning, it's still a good time to watch. Thank you for joining us today. I'm your host, Riva Galvestan, and I am excited to learn more with each one of you. Yes, today our topic is Women Talk, Men Listen. So, this is not just for women, this is also for men. Don't judge the title and say, oh, it's not for me. I'm not a woman. But you know what? We are here to understand more about how we can minister to other women or share with other women. Also, for men, how can we understand where women are coming from? That's so important. Yeah, if you missed our episode last broadcast, that was like 2 weeks ago, yes, about advanced care planning, I would like to encourage you to check out our YouTube page, social media channels. We also have CCF Life to the Max on Facebook and on Instagram. So it's very important to plan ahead with all the other elements, not just in the medical aspect, to prepare our families for the end of our lives. So, yes, check it out. It's for free. We share that with your family and friends. Yes. So, we know that a lot of people actually struggle with reproductive health problems, and not many are aware of it. But we are here today to know more about that. Many men also don't realize that some of the problems they encounter with women actually involve perhaps a reproductive health issue. So again, no generalization, just listen. And I know it's a different case for each one. All right. So why don't we go to introducing our special guest? But before that, actually, I want to remind everyone that there will be a Zoom discussion room after our broadcast. So if you are joining here for the first time, we have a room especially for you, room one. But if not, you may join the room that you've been joining, and we will share our Zoom details later. We also have our Q&A portion, so please do share your questions later, and we endeavor to answer as many questions at the time will permit. Yes, okay. So please stay with us till the end. And now I'd like to share with you our special guest. Who is our special guest? We have two special guests. So, first, I'd like to introduce our resource person who is a respected figure in the medical field, specializing in women's reproductive health. She attended Silliman University for her pre-med studies, earned her Doctor of Medicine at the University of the Philippines College of Medicine, Manila. She's currently the head of the Women's Healthcare Center and training director of the OBGYN ultrasound section of the Medical City. As an OBGYN doctor, her subspecialty is infertility. So those who want to get pregnant, of course, it's the Lord who provides for us in his time, the blessing of a child. But yes, there is also the wisdom from the Lord through our doctors who specialize in this. Yes, so she's also a member of the executive committee of the OBGYN department, plus chair of the hospital credentialing and privileging committee, also of the medical city. On top of that, she's a lecturer at the Ateneo School of Medicine and Public Health, the Department of OBGYN, and at the same time, the project chair of the Task Force on Gender-Based Violence Reproductive Health Committee of the Philippine Obstetrical and Gynecological Society, OBGYN. Yes. Her successful career in the medical profession was built on solid foundation. Well, first, we know our doctor is really rooted in Christ as her solid foundation. That's the most successful part of her life, of course, being in Christ. But medically speaking, her proven track record lists her as the past chair of the Philippine Board of Obstetrics and Gynecology, as well as the Council for Residents, Education, Enhancement, and Development. She also served as past president of the Philippine Obstetrical and Gynecological Society, Philippine Society of Ultrasound in Obstetrics and Gynecology, Philippine Society of Reproductive Medicine, and Philippine Society of Climacteric Medicine. Climacteric, yes, did I pronounce it right? There. So wow, there's so much to share about our doctor special guest today, but I won't extend it anymore. I just want to introduce our loving and faithful doctor who's married to another doctor, Dr. Cesar Chua, a general surgeon and cancer specialist. So they met in med school. Well, but no sparks flew then until their homecoming. So our dear doctor also has two sons from first marriage, and her present husband has three sons from his previous marriage, giving her six grandchildren from their blended family. So let's welcome Dr. Lyra Ruth Chua. Yes.
Hi, good morning. It's a privilege to be here with you this morning.
Thank you, Doc. Yes. I don't know if they were able to download all the things I shared in the intro, but you know that definitely Doc Lyra can share so much today with all her experience. Yeah. So, Doc Lyra, let's go straight to our discussion. You know that there's a lot to discuss, but we also have very limited time, so we'll only discuss some parts of what Doc Lyra would discuss in a major lecture that would take hours. So please don't expect a kilometric lecture here. Yeah. So Doc Lyra, of the many branches of medicine, what made you choose? What made you want to be in women's health and OBGYN?
During medical school, I wanted really to be a psychiatrist, to go into psychiatry because I was interested in looking into people's minds and knowing why they do what they do. But during my fourth year as a clinical clerk, I was left by the resident to deliver a baby, a woman who was beginning to show going to deliver already. You know, the baby's head was already crowning, and the resident told me, Lyra, ikaw na mag-deliver niyan. So when I delivered that baby, it gave me a thrill and a sense of fulfillment. And that's when I decided to go into obstetrics and gynecology. That really was an experience that was a turning point in my decision to become an OBGYN.
Oh, there you go. So that turning point uh, mattered so much. And of course, we know how the Lord places you where, he knows what is best for you as well.
Yes.
So very, very interesting. So surely you've seen a lot of cases, of course, different issues of women in their health. For everyone's info, before we move forward, this OBGYN, not everyone understands this term, Doc Lyra. So, what is the difference between obstetrics and gynecology?
Yeah. Obstetrics is the care and the management of the pregnancy and childbirth. So we take care of the woman from the very start of her pregnancy until she delivers and until she gets over the what we call the postpartum period, which is about 6 years, 6 months after delivery. And gynecology is the management and the care of the non-pregnant woman. And so this is where we take care of all of the other concerns of the woman as she goes through her reproductive years.
There, thank you for the differentiation. Yeah, it's also something that the men should understand. You're going to an OBGYN. It's not just for people who are giving birth. Okay,
Yeah,
Doc
yeah,
Lyra, what are the most common problems among women from the time they enter puberty?
yeah. Okay, well, I'm glad you asked that question because in my clinic, the three most common problems and complaints that patients come to see me for are number one, pain, number two, bleeding, abnormal bleeding, and number three, mass. No, they feel a mass, or their husbands feel the mass, or other people feel the mass. So all these three are the most common ones that patients come to me for, especially the pain and the bleeding. These are the two most common complaints of patients.
And why does it happen that way? And what's the cause? What could be the reason for that? I know it's different for every person, but I would say it's a general note on why these things happen, what causes it.
The pain could be due to so many things, and I would just like to focus here on the pain that they have during their menstrual periods, and we call this dysmenorrhea. And so when the patient complains of dysmenorrhea, it could either be either primary or secondary. Primary means dysmenorrhea where we don't find any reason or any cause for the pain. And the secondary dysmenorrhea is when the menstrual pain is because she has conditions like endometriosis or myoma or even ovarian new growths or ovarian cysts. No, and all of this could be diagnosed when we examine the patient, we get a very good clinical history, and when we do the diagnostic tests like an ultrasound and some blood tests that are relevant to the condition. So
Yeah.
it really has to go through a process before we could give a good diagnosis for the reasons these patients undergo the complaints. It's the same thing with the pain and with the abnormal bleeding. The very most important thing in these conditions is that we get a very, very good clinical history. We always ask when they started their menstrual periods, when we call that the NARC, and then we ask how regular the periods are. That's why at this point I would like the ladies in the who are listening to please take note of your menstrual periods. No, take note of when they started, when they ended, how regular they are, because these questions will be asked of you when you go to your gynecologist for these problems.
Yeah, so we have to document that regularly.
Yeah, yeah.
Yes,
Put
and what
it on your calendar.
yes, and what also happens during the period, Doc Lear, we should record if there is dysmenorrhea
Yes,
or
yes,
something like the flow of the blood, right?
yes. Right, right, right,
Heavy or
right.
yeah, yeah.
Yes.
So yeah, there are things to take note of if you haven't been doing that. It sounds so simple, right? But it's very essential. So I know, Doc, among these common problems, some dismiss it, some are like, oh, maybe it's just a normal thing. But what should we be more concerned about? Like, for example, yung normal bleeding, abnormal bleeding, how do you know if your blood flow is actually normal or not?
Okay. Normal menstrual periods would usually come come regularly at every 28 to 30 days or maybe 26 to 32 days. No, that's the usual normal intervals, and they should last for not more than 7 days, and the patient should not bleed heavily, meaning they would probably consume about 2 to 3 napkins per day, menstrual pads per day, and then over the next few days, the bleeding should diminish little by little until it stops completely. Now, if the bleeding lasts for more than 7 days, the bleeding is so that they really soak their pads, and sometimes they already need maternity pads or overnight pads even during the daytime, and they have accidents, no, they natatagusan kumbaga. And then when there is pain during these menstrual periods, especially when the pain lasts for the whole time that they're bleeding, then those should already be brought to the attention of their gynecologist. They should already go see the gyne.
Yeah, there you go. So I don't know the size of your napkin, but Doc Lira gave a good example. If you're already using uh, more than how many pads in a day or the kind of pads that you use,
Yeah.
obviously there is
And
something
you soak
wrong.
the pad in 1 to 2 hours. That is
Yeah.
already heavy menstrual bleeding.
Okay. All right. So, Doc Lira kasi meron na ngayong thin pads, di ba? May makakapal. So,
Yeah,
obviously,
yeah, yeah,
whatever you're using, if you know it's more than the usual, that is
yeah.
excessive. Yes. So, how about, Doc Lira, the dysmenorrhea? Many people go through this. Is it always a common thing? Sometimes it's also accompanied by cramps, headaches, dizziness. So
Mhm.
what are the causes of this
Okay. So
dysmenorrhea?
again, no,
Yeah.
with the menstrual pain or the dysmenorrhea, um, we try to look for the cause, no, whether it's caused by abnormalities in the reproductive organs of the patient. When we don't find any, we just everything is normal. Then we say it's probably primary dysmenorrhea, and primary dysmenorrhea usually would come about a few days before the menstrual period, would last for the during the first, but should disappear by the second to the third day. And they would usually respond to one or two tablets or capsules of the pain reliever that the patient usually takes. But if the pain, the dysmenorrhea lasts for more than the usual time, does not respond to the analgesics, and much more so if the pain is progressive, meaning it becomes more and more severe as the months go by, then this already could be a sign of something that's wrong within the reproductive tract organs of the patient. And again, we have to investigate this very carefully. Now, I would like to emphasize now that dysmenorrhea, even if we don't see any cause for the dysmenorrhea, should not be accepted as normal. No, sometimes when the patient says sumasakit ang puson ko, complain to their mothers would say, ay, normal lang yan kasi ganyan din ako noon, nawala siyang nung nabuntis ako. But as I said, if the pain, if the dysmenorrhea becomes more prolonged, more severe, then that patient should already go and see the gynecologist. It should not be normalized. No, in fact, in the hospital now, some female employers are asking that they be given leaves when they have their menstrual periods, and that would be very detrimental to the company or to the whatever company they're working in. And so therefore this should not be, it should be looked into so that the reason will already be diagnosed and management could already start. Because this, if left unattended to, could lead to what we call endometriosis, and endometriosis is something that could wreak havoc on that patient's life, including infertility. It could lead to infertility later on.
Oh,
So
okay.
I
So we
think the
should not.
message I want to say is
Yeah.
dysmenorrhea should not be normalized,
Yes, and do not underestimate the
not
impact of that.
underestimated, not
Yes,
ignored at all.
yes, not ignored. Yeah. Okay, so don't self-medicate. Number one also. Some
Well,
people
you can,
like
but if it doesn't go away, then go to your doctor
yeah,
already.
yes. Only for the pain reliever, Doc Lyra, but everything else they should consult. Yeah,
Yeah,
you or
yes, yes.
an OBGYN. Yeah. How about polyps? There are people asking about this. Is it true that
Yeah.
this can lead to some more serious problems when you have polyps?
Well, polyps will be diagnosed when the clinical history usually of polyps would be that the patients have their usual menstrual periods and then they bleed in between the periods. We call that intermenstrual bleeding. Or sometimes
Mm,
the bleeding could be prolonged, but the prolongation would be just in spotting. And or sometimes the patient would notice spotting when she lifts heavy things, or when she strains when she's constipated, or when she coughs, no? So this would result in some spotting. And the polyps could be diagnosed by imaging or by ultrasound, no? But it's either a transvaginal ultrasound or a transrectal ultrasound. And uh, polyps could also be asymptomatic. Ibig sabihin, they don't have any kind of bleeding at all, but when we examine them, then we see polyps. So polyps could be present in about 1 in 4 of women with abnormal uterine bleeding or abnormal menstrual bleeding. So again, any kind of abnormal menstrual bleeding should already be seen by the gynecologist and
yes.
investigated.
Yes. Do not wait until it worsens. Yeah. So,
Yeah.
Doc Lyra, what type of procedures are performed for the diagnosis of more serious reproductive health conditions? Yeah. We know there's
Okay.
the
Yeah,
cancer, yeah, but what other um well, sicknesses should be or should we watch out for, and what procedures do we use
yeah.
to diagnose?
Well, yeah, when these patients come to us, we would usually do, again, a very good clinical history. That should not be taken out of the management. That should be the very first thing that we need to do, a very good clinical history, especially the menstrual history. Number two, then we should do a very good internal examination or pelvic examination. And the women, again, should be prepared to undergo, number one, the speculum exam, which is the insertion of the speculum. That's the metal instrument that we use to look into the inside the vagina and the cervix. Then we do a very good bimanual exam, meaning we feel the reproductive organs with my internally. And then if even if we don't feel anything, then we, if there's abnormal bleeding or there's abnormal pain, then we already would request for an ultrasound. And yeah, if the woman has already has been is married or already has had children, then it's a transvaginal ultrasound. If the woman is single and hasn't had any a partner yet, then what we do is a transrectal ultrasound. So that's those are the imaging that we would usually do. The first line of choice for imaging in these women. And then this is when we would already be identify the causes or the reasons for the pain and the bleeding and even the masses. This is when we would see the masses that would be that would be seen in that particular patient. So this is where we make a diagnosis of polyps, myomas, ovarian cysts, all the other reasons for women's problems.
No. Okay. So, doc, does everyone have to go through that annual checkup? Or, uh, not everyone goes through it.
Yeah, right. Well, I emphasize that to my patients. Please come see me at least once a year, even if you don't feel anything. Now,
Mm-mm.
those once a year visits would entail taking a look at them, their physical examination, taking their blood pressure and their weight, so that if there's anything going wrong, then we already begin to manage those. And then, of course, the gynecology exam would be the internal exam, the pelvic exam, plus a pap smear. So I always advise my patients to have pap smears every year, if even if they don't feel anything. But especially when the patient has post-coital bleeding or bleeding after sexual intercourse, then they should really go and have that pap smear with their doctors. And then in my practice, even if the patient does not have any complaint, I usually do a transvaginal or a transrectal ultrasound, especially transrectal ultrasound is not mandatory for these patients unless they're complaining of something specific, which I'd like to see. But the transvaginal ultrasound will already make tell us that there's something going on. Because right now, the ultrasound machines that we have that using transvaginal ultrasound would already show masses in the ovaries that are this small, less than 1 cm, we could already see them. The polyp that's less than 1 centimeter, 3 mm, 3 millimeters or more, we already see these polyps, especially when we do the specialized ultrasound procedures like a saline infusion sonography. So this is when we make a diagnosis of polyps and submucous myomas. I'm sorry I'm using the terms, but these are the things that I think everyone is familiar with myomas, no? So these are the structures, the abnormalities that we see when we do the transvaginal examination. And so the patient is aware. Well and good if she goes home and she says there's nothing wrong with me, but she has to come back the next year for me to be able to track the health of her reproductive organs.
Yes, thank you, Dr. for reminding us of how important and necessary it is to go through that annual checkup. So we know that there are factors that contribute to common female reproductive conditions that can develop into cancer, right, Doc? So how do we know what these factors are and how to avoid it? Anything that you suggest for us, aside from, of course, going for a regular checkup, but what are the things, factors that we should watch out for that can contribute to
Okay.
cancer?
Number one, lifestyle. So if the
Mm-hmm.
patient, if we see the patient beginning to gain weight, and we tell them, please try to control that weight gain, because obesity is responsible for a lot of conditions that may develop into even more serious conditions like cancers. Number two would be diet. Um, we usually, it's now known that red meats, having red meats in your diets could result in myomas, endometriosis, and a lot of other things like adenomyosis. So again, we try to tell the patient to eat more of the fruits and vegetables rather than the red meats and all of those other meats. And number three would be stresses. Stresses are now also considered as one of the risk factors for um, patients developing abnormalities in their reproductive system. Number four would be family history. So we always ask for family history of cancers and all of those other things, because if the patient has had a family history of cancers and in her parents or grandparents or even siblings, then that would give them a genetic predisposition to cancer also. And this is especially true in breast cancer, ovarian cancer, colorectal cancer, and I think those are the three most common cancers that have a genetic predisposition. We, of course, know already that lung cancer is related or is most often due to smoking, but there are also conditions that are not due to smoking. Cervical cancer is due to infection by the HPV virus or the human papilloma virus. That's why the women today are lucky, because we now have a vaccine against this HPV virus, which is the most common cause of cervical cancer. So please go, no, young ladies, young women, teenagers, please tell your moms to bring you to her gynecologists so you could already receive the vaccine against the virus that causes cervical cancer. So that would be more or less the factors that would result in abnormalities. But some would not have anything to do with what I just mentioned. They would just appear because that was um, that was they were born with that what you call, if you could call it, the fate to have these conditions which are
Mm-mm.
not due to anything that I mentioned.
Mm. Yeah. Thank you, Doc. But we also know that God is sovereign over everything He creates. So for those
Yes.
who have that condition at birth, the Lord is faithful to use that also for His purpose. And we will know more about that through our next guest, whom I'll introduce, because how you'll see how the Lord is really using her through her current condition. We'll share more about that after this question. Doc, last, before we call our next guest, after the diagnosis of the gynecologic cancers, what are the standard and special protocols for their treatment and management?
Well, at this point, let me just say that our sharer has a very, very good story to tell us, and
Yes,
I think we will see that God really is sovereign and was
yes,
over everything that you went through. Now, going to your question, you use the word protocol, and yes,
yes.
indeed, we have protocols for everything. We have the flow charts. We also call it the algorithm. So, like patient complains of pain, then the next box would show what to do, clinical history, then PE, and then the next few boxes would already go put arrows to what should be done, like if it's a transvaginal ultrasound or if it's going to be already a biopsy. And so these protocols are in boxes that follow one after the other. So each and every one of the complaints and then each and every one of the diagnoses will have protocols to follow, including management already of the cancers. So again, management of the cancers would classify the cancers into the stages. That's why it's very important when we deal with cancers that the stage should already be determined, because the management of these cancers would depend on the stage of the patient when the cancer is diagnosed. I hope
Yeah.
that answers
Yeah.
your question, Riva.
Thank you, Doc. Actually, my question is not just my question, but it's a question of many people. Of course, they
Yeah,
want to
yeah, yeah,
know
yeah.
how it's treated and managed. But of course, again, it's different for every person. There are protocols, but it's managed, of course, specifically for the people who are going through it, and Doc can share that when you have a checkup or when you're going through it already. Yeah. So yeah, speaking of our other guests, are well, only one other guest, and she's not just another guest, but a very special guest. I'd like to introduce her. We've been mentioning her. So, Kyla, she's an alumna of Lyceum of the Philippines, University of Manila, finishing a degree in Bachelor of Science in International Travel and Tourism Management. She's currently a freelance primary Mandarin teacher and production assistant for the Anchor of Hope Live radio ministry. Yes, so check that out, Anchor of Hope Live. Yeah, I think they're also online, right, Kyla? So you'll see later. She's the second child of three children. Her father Paquita and mother Grace, with a older sister Faye before her and younger sister Catriona after her. She is quick to add that she's also a fur mom to her baby poodle named Roku. Still young, she's actually turning 29 years old this month and single at that. She is one brave soul to tell us about her challenging journey as a woman, a follower of Christ, and going through her reproductive health concerns. We will hear more about her journey with a rare gynecological case. We can all learn from her, and not just with her health case, but how the Lord is really shaping and molding her through this. So why don't we welcome Kyla, Kyla Ysabel Yeneza.
Hi everyone, good morning. It's so good to be back again. If I remember it correctly, I was bald when I last spoke here, right, at Iriva, and now I'm back with a brand new hair. And thank God for new hair and the hairs that we have, right, at Iriva?
Yes, yes. Thank you, Kyla, for joining us once more. Yeah, if you missed the previous episode, Doc Lear also has guested here before, but they're all on our YouTube page, and CCF Live to the Max also on Facebook. So yeah, the beauty of having videos on demand, you can review it. So yeah, thank you for being here, Kyla, and we're really excited about your story. We've been talking about it. Of course I know about it, but our viewers would like to know more about what this serious reproductive health problem is. What you're going through. When was it diagnosed, and how did you uh, go about it during that time?
So I'm happy to share my story. So I was diagnosed with endometrial cancer, and the type of endometrial cancer that I have is clear cell carcinoma. So what is clear cell? So clear cell is a rare and the fast killing kind of endometrial cancer. So I was at stage 3C1 in December 2021. And I believe I have a picture right after my total hysterectomy. Can we show that picture, please? So there you go. So that picture was the day after my total hysterectomy in December 2021. And when I had my first PET CT scan in January 2022, I was raised to stage 4B due to the metastasis that I have in the liver. And when everything was happening, the cancer was happening to me, I was only 27 years old at that time when I was diagnosed.
I have no words, but just amazed by how the Lord has been sustaining you, Kyla, through this. Thank you for sharing that photo also. And I know that many people are conscious about their hair, but I know that you are more concerned about how God is really making your heart more surrendered to Him through this journey. So we'll see how Kyla is just a model of that, how her heart is surrendered to God. So, Doc Lyra, with many years behind you, of course, your experience as an OBGYN specialist, can you tell us more about Kyla's condition and what is the function of the endometrium and the reproductive system? Yes, so Doc Lyra, would you like to share more about Kyla's condition? Doc, you're on mute. Doc Lyra. Yeah, kindly unmute.
Okay.
Yes, there you go. We can hear you now.
The endometrium that Kyla mentioned is the lining of the uterus. It is where the menstrual blood comes from every time a woman has a menstrual period. The lining during at the start of the menstrual cycle, immediately after a menstrual period, is thin. And over the next few coming days, about 7 to 10 days, that lining begins to regenerate, to repair itself, regenerate, and it begins to thicken under the influence of the hormone estrogen. And then as it begins to thicken, the ovaries, on the other hand, are already developing and beginning to produce the egg that will be released at ovulation. So the whole, let me just mention that the whole menstrual cycle of a woman is meant to produce an egg so that that woman will be able to get pregnant. Now, ovulation would usually happen at mid-cycle. So if it's a 28-day cycle, just to simplify things, ovulation will happen on day 14. So the egg is released, and if the woman has a husband and they have sexual intercourse at that time, then pregnancy could occur. Now, that part in the ovary that release the egg now becomes what we call the corpus luteum, and the corpus luteum begins to produce progesterone. And progesterone is the hormone that supports pregnancy. Now, pro is for, and gest is pregnancy. So, progesterone is produced in order to support and maintain the pregnancy if the woman gets pregnant. However, if the woman does not get pregnant, that corpus luteum regresses, it self destructs itself, and then the progesterone suddenly drops, estrogen also suddenly drops, and that's the onset of the next menstrual period. Now, let me just say that the polyp develops within that endometrial lining, and it develops as an overgrowth. Parang sumobra ang tubo, no? Instead of the endometrium growing or regenerating to only this thick, that polyp develops much more in that particular place, and it develops as a grape-like structure. So polyps are grape-like structures that branch out from the usual endometrial lining, and it could be seen, as I said, by transvaginal ultrasound. So that is the function of the endometrium, and in the menstrual cycle and during pregnancy. But when something goes wrong in the endometrium, that's when the abnormal bleeding happens.
There you go. So, uh, now we understand more how Kyla's condition is. So going back to Kyla, let's just backtrack a bit. How did it all start, and what symptoms were you experiencing that gave you the signal? Wait, maybe I should consult. But like what Doc Lyra said earlier, you should consult every year with or without symptoms. But yeah, so Kyla, how did it start for you?
So, when I was 21 years old, I gradually started to experience intermenstrual bleeding. And I believe Dr. Ira mentioned that earlier. So, intermenstrual bleeding or prolonged menses. So, what do I mean by prolonged menses? It is like you just finish your menstrual schedule in a particular month, and then after a few days there is spotting and bleeding again. Or according to Mayo Health Clinic, this refers to vaginal bleeding at any time during the menstrual cycle other than during normal menstruation. So when my mother noticed that I was having prolonged menses, and I was also asking her to buy more female napkins at that time, she was the one who told me to go see an OBGYN or OB-GYN. When I finally saw an OBGYN, my hemoglobin levels were already low because of my prolonged menses. Tinudugo ako. And since I was very young, 21 years old, single, and hadn't had any sexual intercourse, my OBGYN was very protective of me. So the medical action was to go through conservative management to avoid invasive procedures. And after about a year of monitoring upon a transrectal procedure or transrectal ultrasound procedure, I was found to have a polyp. But considering my age at 21 and physical get up, I am not obese. So Doc Lira said that um, obese are one of the factors of hormonal imbalance. This did not raise much concern, as most polyps are considered benign. Later on, further transrectal examination revealed PCOS as well. So I went through pills to balance my estrogen and raise my progesterone levels. My hemoglobin levels through CBC were being watched. I also took iron supplements and tranexamic acid to control my bleeding. The iron supplements plus progesterone injections worked for a while, but the prolonged menses returned and worsened. Finally, in November 2021, I had to undergo an operative hysteroscopy to remove the polyps, which was believed to be the prolonged menses. During the hysteroscopy, they found more polyps. When the biopsy result came out, I was malignant of endometrial clear cell carcinoma.
Oh, grabe, Kyla, what you went through. So yes, we should be very much observant and monitoring the bleeding and what Dr. Lira mentioned earlier, all the other factors that we should really take into consideration. So let's pause right there. And I know, Kyla, I'll ask you later how you felt when that happened. I have a question for Dr. Lira. What does progesterone do to the female body? Dr. Lira, you're on mute again. Yes. There
Yeah.
you go. We can hear you now.
Yeah.
Yeah.
Progesterone is the hormone that limits the action of estrogen, because a woman who does not ovulate, I already mentioned ovulation a while
Mm.
ago, a
Yes.
woman does not ovulate will continue to produce estrogen, and the unopposed progesterone opposes estrogen. So when the woman does not ovulate, there is no progesterone produced, and that unopposed estrogen will just continue to thicken the endometrium, and this is what would cause bleeding, heavy menstrual bleeding in that woman. So progesterone, as I mentioned again earlier, is not only to protect and to maintain the pregnancy, but in women who are not pregnant, it is also used to oppose the action of estrogen, so that the women do not undergo the heavy menstrual bleeding that would result if a woman does not ovulate.
Mm.
So yeah, that's the action of progesterone. No? It inhibits the action of estrogen. Parang it opposes, no,
Yeah.
it inhibits the bad effects of unopposed estrogen.
Yes, thanks, Doc Lira, for clarifying that. So, Kyla, yeah, I wanted to ask, how did you feel, and what was going on in your mind when you were having that biopsy and that showed that it was cancer? How was it for you, and how did the Lord deal with that? I mean, how did you deal with it with God? Of course, God knew already how to deal with it.
So it was still during the pandemic when I had to go through hysteroscopy to remove the endometrial polyps. And I was looking forward to having my prolonged menses finally over. But a few days after hysteroscopy, the bleeding has not stopped. And then my mom usually picks up my biopsy results for me. But this time, I took it upon myself to go to the hospital to pick up the biopsy result alone. When I opened the document, I read the word malignant. My eyes just passed through the word clear cell. I did not know at that time what clear cell meant. So I only understood what, okay, malignant, cancer. So malignant equals cancer. So seeing the word malignant, the world crashed down on me and I felt cold. My knees melted and I had to sit and cry my heart out. I asked God, why did you allow this to happen, Lord? To anyone listening here who knows my story, I went through 3 previous surgeries for other medical health conditions before this fourth one with hysteroscopy. And the last 3 surgeries were benign. How can this be the fourth uh, one be malignant? And later that week, I learned what clear cell is. So, and then I wondered, how can a good God allow clear cell to be my kind of endometrial cancer? Why not the more friendlier type of cancer, which is endometrioid, right, Dr. Lyra, and which is a non-moving variety instead. So sana endometrioid na lang, yung ganon.
Yeah, Kyla, I can imagine the many questions that were on your mind and really asking God why. I know that God is also answering that. Many people have that question, and of course, when it comes to sickness, I I know by default we'll prefer the friendlier one, as you said. Yeah. So, Kyla, just to follow up with what you said, right when you read Malignant, it didn't really sink in yet. What other struggles did you have that time aside from what you already mentioned?
So actually, when the biopsy result came out, or when I received the biopsy result, it was actually December 8th, and it was the day after we celebrated my mother and my sister's birthday. Di ba masaklap? That night, we had the shock of our lives to learn that I had cancer and it was clear cell carcinoma. My mother researched it, and after a discussion with her sister and an OBGYN nursing supervisor in the States, which is my tita, they agreed that immediate surgery would be necessary to arrest any spread of the disease. And then looking back, I had to struggle with the fact that I needed a total hysterectomy. And considering my young age, at 27 already at that time, a gynae endocrinologist suggested harvesting and freezing some of my eggs to allow the possibility of having a child in the future. But doing so will take time as tests are needed to see if this is viable. And of course, there is also the question in my mind as to whether or not I waited too long. So I also had to go through some, blaming at that time, and which is actually valid for for having that emotional pain. So if I had to undergone hysteroscopy much earlier, would there be no cancer then? Should I blame the doctor? Should I blame myself? And the mental anguish was so difficult to contain. All I can do, or all I could do, was to cry to the Lord for strength.
Oh, wow. It's a lot to process, Kyla. And like you said, it's something that you have to go through honestly, sharing with God how you really feel, the what ifs, what could have been. So overall, we're reminded that God allowed it at that time in that manner, and like I said, we'll see how the Lord has been using Kyla also, with what she's going through. So, Doc Lyra, we know that there are some tests, like diagnostic tests, like you mentioned. Could Of course there could be a misreading of the result, or it could be possible that you had the test a couple of weeks ago, and then when you go for another checkup, there's a different result. So, how do we actually process that, the reliability of these tests? I know, of course, there are things that people have to consider also when taking these diagnostic tests. So, Doc Lira.
Yeah, yeah. Well, at the start, I'd like to say that Kyla really was a very, very rare and unusual case of clear cell carcinoma. Number one, polyps would usually be seen only in the older aging woman. It's very seldom that we see young women with polyps. The youngest I've seen was already a 30 or 30, 35-year-old patient. So I haven't seen a polyp yet in a young woman patient like Kyla was at age 21. Number two, the incidence of polyps becoming malignant is usually only 3 to 4%. And so therefore, as was done with Kyla, we usually do not worry too much about it. But again, as I said, when the woman has abnormal bleeding, then that should be investigated. And that was done. A polypectomy was done. And then number three, um, there's actually, it's really a puzzle. Kyla did not have any of the risk factors. Kyla was young, and it's something that just happened. I would say, no, it's not because of anything that I mentioned about cancers earlier. Now, about clear cell carcinoma, it's again one of the rare endometrial cancers. As Kyla mentioned, endometrioid cancer is more common because it comes from the endometrium. No? Endometrioid comes from the word endometrium. And clear cell carcinoma is usually seen in ovarian cysts and in other cysts. But let me say that clear cell carcinoma develops from an endometrial cell also. Okay, so it occurs in about less than 5% of all endometrial cancers in older women, and as Kyla mentioned, it's very aggressive because when she did diagnostics, had already invaded her ovaries and even spread already to your liver, no, and where else? Okay, anyway, it had already spread outside of the pelvis. So regarding the question of how good our diagnostics are, well, the histopath is already right there. So that would already be accepted as the real thing, no? The histopath diagnosis of clear cell carcinoma. The diagnostics, well, it really depends on where it was done, but her diagnostic scans were done in a very, very good hospital where the doctors who perform them are all experienced and skilled. And I would really rely on these examinations. So, yes, I agree with Kyla. It's something that you really ask. Why?
Yeah. But Doc Lira, just a follow up. What could have been done differently? Of course, again, this is not because we're saying okay, maybe this could have been prevented altogether, because that it's really what's on the mind of someone like Kyle is like, well, did I miss out on something? Should I, like you said, should I have gone earlier and done this, etc. So, Doc Lira, what would you say, like, in terms of Kyla's case? Because remember, she had her first polyp detected when she was 21, but it was only when she was 27 when the serious underlying condition was discovered. So, what uh, would you share regarding a case like that for
Yeah.
others? Of course, we know that if it's really something that the Lord has planned and allowed, we cannot totally prevent it in that sense
Mm.
because He has a purpose for it. But on a medical note, perhaps how can we uh, go about? What would you teach your students if they were in that situation, Doc Lyra?
Well, okay, it's like this. No, once a polyp is diagnosed in a patient who is bleeding, because you know what, when we see a polyp but the patient is not bleeding, then we don't do the hysteroscopic removal yet. We just observe, monitor. If it's growing bigger, then that's when we take it out. If the patient develops bleeding, then we take it out. But if the patient is not bleeding, does not have anything and no pain, then we just observe it and monitor it. Now, the moment a polyp is taken out, the bleeding should stop. But then Kyla said that even after the hysteroscopy, the bleeding continued, the heavy bleeding continued. So it means that there really was something in that endometrium that was going on, not due to the polyp. And I asked for her histopath report, and the histopath report said that the cancer was more in the lower part of the uterus.
Yes.
So so, I would say, of course, the polyp would already show the clear cell carcinomatous changes because maybe it's those carcinoma in that part of the endometrium where the polyp arose from that already had the cancers. And again, in fact, that's the very reason why sometimes even if the patient does not have any symptoms, is not bleeding, then we just remove the polyp because the polyp may mask any cancerous findings that would be behind the polyp, especially if the polyp is huge, is big. If it's very small, then that's only for observation, monitoring. But if we sometimes see polyps that would occupy the whole of the endometrial cavity, and these polyps have to be removed.
Mm, yeah, so there we have a picture of how to handle that. Yeah, it's actually
Okay, let me just add,
yes,
maybe
Doc
just
Lyra.
for everyone to know, if the bleeding continued even after Kyla already had that polypectomy, then a DNC should have helped make the diagnosis earlier.
Oh, okay, there you go. So some lessons learned, but again, it's also for the reference of others who may be going through
Yeah.
something like what Kyla went through. Again, we can do our part to prevent, but at the end of the day, of course, we are not God. So our actions, of course, cooperate with what the Lord wants if it's His will, and if there's something we decide that the Lord will also allow it. We cannot prevent that totally. So yeah, let's just go back to Kyla's story. So Kyla, after your total hysterectomy, what treatment did you undergo, and how was this time of going through treatment for you? I'm sure it was very tiring also going through all the tests and the treatment. Yeah.
So yes, I underwent total hysterectomy on December 27, 2021, and after 3 weeks, I underwent a PET CT scan, and the scan showed a nodule in my liver, which indicated that my cancer has already progressed to stage 4B. I was scheduled for 6 cycles of chemotherapy, but after 3 cycles, I had my PET CT scan. After the 3 cycles of chemotherapy, it showed that the chemotherapy was ineffective. And then more lesions were found in my liver. My medical oncologist therefore decided to switch my treatment to immunotherapy instead. And by God's grace, my body responded well to immunotherapy. And after 3 cycles, the lesions in the liver regressed. And after 3 more cycles, the cancer cell activity was gone but transferred to the iliac and the stomach. So that is a, that is a lymph node in your in our stomach. So far I had 24 immunotherapy sessions, over 1.5 years. So 1.5 years. My latest PET CT scan showed that the activities in the iliac area and the stomach are also gone, and only an inflammation in the liver remains. This is what is being monitored now. Thank you, Lord. Praise God.
Yeah, praise
No,
God.
praise God for that. Thank you, Kyla, for sharing how your treatment was. And Kyla, just to go back to what you said earlier about your struggle with, of course, going through this journey. We see how, the Lord has really made you more steadfast. But I also know that you had a struggle about the part where you were, of course, praying about. I know you. If you will not have a child because of this, what was it about harvesting your eggs? That how did the Lord use that for you to see what He's also teaching you?
Yes, you're right, Ate Riva. I really did struggle about the part of the Lord not allowing me anymore to harvest my eggs because the cancer was really fast spreading toward across my body. And yes, because I struggled because I love children, and I look forward to someday having my own children. But in the end, I had to forego this because the immediate concern was preventing the spread of the cancer and saving my life. And Christmas holidays were also fast approaching at that time, and most doctors were going on leave. One doctor suggested waiting for January 2022 to perform the total hysterectomy, but my mom was adamant about doing the surgery soonest because MRI results showed that aside from the endometrium, my left ovary was already infected. So that was the answer why harvesting the eggs wasn't already the option. And then we prayed for God to give us the right doctor. My mom's OBGYN has been giving us advice all this time. She called the night of December 22 and suggested that we consult a vice president of my hospital, St. Luke's Hospital in Quezon City, who was himself an OBGYN oncologist. Fortunately, this doctor agreed to see us the following day, and upon seeing that it was clear cell carcinoma, he decided to do the surgery immediately after Christmas. And according to him, we have to be more aggressive than the cancer.
Oh, there, yeah. So I know, Kyla, the Lord knows your desires also. And at the end of the day, really have to submit this to the Lord, because even if it's something like what you said, or you just want to have a child and you love kids, again, God's ways are are different from
if
ours. And
if I may
yeah,
add quickly, even though
sure.
I will not have a child anymore, the Lord gives pets. So at least I consider myself still a parent, but now a fur mom with my
Yes.
baby poodle Roku.
Yeah. And of course, your spiritual children as well.
Yes.
Kyla's been so faithful to, of course, disciple also, and mentor young women like her. Not necessarily going through the same thing, but Kyla also does reach out to people who have cancer, even those the Lord has entrusted to her. Uh, that it's part of her spiritual motherhood. So,
Yes,
yeah,
young adults.
yes, there. Thank you. Yeah, Kyla's been an encouragement to so many people. So yeah, Kyla, I know that well, you also reach a point perhaps when you felt so tired already. Maybe you're tempted to give up. What was your lowest point, and how did you draw the strength that you needed? Where was it from?
Yes, actually, there were many points in my journey when I felt so down, like I was at the bottom of a pit. Before I was wheeled into the OR for for her surgery, I heard the cry. Actually, before I was wheeled into the OR for my surgery, I heard the cry of a newborn baby that had just been delivered. That's when I started to cry so hard, as in waiting, because it dawned on me that I will never experience the joy of childbirth. Then, over the year and a half, especially during my birthdays, I felt like the world is passing me by. In fact, October is my birth month, and again I am struggling to bear the pain of not being able to do much. No career to speak of because of the treatment I still have to complete. But meditating on God's word, the love of family, the support of uh the group of cancer patients, young adults cancer patient group, and many other cancer groups has kept me going. And also, if I may add, the support also of my D group family, of my church family. God has been faithful to me. He has provided for all my needs emotionally, financially, and spiritually. Even in my condition, God has allowed me to help other cancer patients through the Life to the Max ministry, the Kaya. Shout out to Kaya Young Adults Cancer Support Group Ministry, Anchor of Hope, and etc. He taught me the divine art of comfort through my trials.
Yes, praise God for how He opens doors for you to share more about what He's been doing in your life, Kyla. Even with the low points, of course, we know that there will always be those points. Even as a follower of Christ, I mean, I know Kyla's smiling right now, but I'm sure there are times she's also crying about many things that she pours out to the Lord. Ultimately, it's how God renews her mind to focus on His purpose, right, Kyla, for why He's allowing this. So, Kyla, when you ask the Lord why is He allowing this, how did He answer you?
How did he answer me is just to, there are times when you have I don't know answer moments in many of the questions of the trials that we endure, or the trials that we have to endure in our lives. And when we don't know, we put that into the faith box and give it to the Lord. And I think that is how he has been, answering me, to just, give it to me. I will take care of you, and just rely on my strength to just continue on with my life. Even though there are still hardships and trials and emotional pains or triggers, or sometimes I still struggle with mental health. So I really have to help myself a lot through many things.
Yes, and as you mentioned, of course, Kyla, you have your friends, family, spiritual family journeying with you, which helps a lot. Of course, because we all need to journey together. Kyla's not alone in her journey. Yeah, and Kyla, I know many people have questions as we go to our Q&A. So before that, Doc Lear, one last question before we go to our Q&A. I know Kyla had history of cancer. Was there a history of cancer in your family, Kyla?
Let me just answer that quickly. Yes,
Yeah.
cancer is also in my genes. Both my grandparents on my mother's side died of cancer, and my mother herself is also a stage 1 breast cancer survivor.
Yeah. So,
Mm.
yeah, Doc Lear, considering family history of Kyla, is it possible to reverse the cancer, knowing that it's in their genes, or if you don't have it in your genes, does it mean that you're exempted? Of course, we know that there, like you said, there's still lifestyle factors that can contribute to this. So yeah, how do you go about dealing with something genetic and uh,
Yeah.
knowing it's in their
Yeah.
family?
Okay. The family history of cancers gives you a genetic predisposition. That means you're not destined to have the same cancer or the other cancers, but anything that those risk factors that I mentioned would make you more easily develop that cancer. Like as I already mentioned, obesity, diet, and the lifestyle, smoking, etc. That's why in your case it was really a big question of why. But I would say that genetic predisposition, you have you have the genetic predisposition, and I think how to prevent it. Well, right now you know very well Angelina Jolie. Um, Her mother had breast cancer. I think she had that test. We called it the BRCA1 and BRCA2 tests. And so when she turned positive for the test, she had both her breasts removed. And then after that, I think she also had her ovaries removed. And this was really a very drastic way of preventing the cancer. So for those who have a family history of cancers of any kind, then the best way is to keep fit, to keep healthy, avoid those risk factors that we mentioned, uh, especially diet. I think the diet these days of our young people, the junk foods, the fast foods, canned foods, all of those things that the sugary drinks, no, all of those would already predispose the patient to the individual to develop into that kind of individual who would easily have acquire the cancers. So I think the best way is really to keep healthy as much as possible, and of course have regular visits to your doctor. Look for a doctor whom you could trust. Look for a doctor whom you feel comfortable with, and stay with that doctor. If you go to a doctor, you don't feel comfortable with her or with him, then look for another doctor. Ask your friends, sino ba ang doktor mo? Do you feel comfortable with the doctor? Is she good? Na ganon ba? And then you please go see the doctor very regularly.
Yes. Okay. So it's very necessary also to have a doctor that you not only trust, but you can also be open to what
Yes,
you're going through, and the
yes,
doctor
yes.
who can also journey with you, not just transact and do a
Yeah,
test.
exactly. Tama, tama, tama.
Yes. Thank you.
Oh, yeah. May I
Uh,
add lang,
sure.
Riva and Kyla, God provided for you, no? The circumstances before you had your hysterectomy, you were able to call the vice president, and that vice president turned out to be a very, very good, thorough cancer surgeon, gynecologic cancer surgeon, and I looked at the report. He did a very, very thorough job of cleaning up the cancers in your body. That was God's provision for you, I'm
Yes,
sure.
that was God's hand indeed. Praise
Yeah,
God. But God's
yeah,
grace.
yeah.
Yes. All right. So thank you for sharing your answers to our question. Now we're already in our Q&A portion. So Q&A is for our viewers on Facebook, on Zoom, uh, YouTube who would like to ask questions, and we're here to accommodate. Given the limited time, of course, we can't accommodate all, but yes, we will do what we can to accommodate. So, is it true that single women are more predisposed to cancer in their old age compared to married women who have given birth? So, Doc Lyra
Okay, single women means women who have never been
had
pregnant, who have never
sex,
been pregnant. Of course, we have single women who got pregnant also. No, that they have
veteran, yeah,
delivered.
and
And
yeah.
so I think that these
I'm
are
not sure, Doc Lyra, because it just
the
said single.
question. The question
Yes.
is referring to women who have never been pregnant, and then women who have never been pregnant are more prone to develop ovarian cancers. Women who are married and have been having children are more prone to develop cervical cancers. So more or less, that's how we we look at the single versus the old women. Women who breastfeed are protected against breast cancers. So therefore, these days we advise all our women to breastfeed their babies for this, at least for the first 6 months of the baby's life. And then what else? Endometrial cancer. These are women who have very, very irregular periods, such that they skip months of not having periods, and then when they do have their periods, then the period is heavy. So these are the women who are more prone to develop endometrial cancer when they grow older. As we said, cancers are usually seen in the older age group, and so therefore, although there's also cancers that are more seen in the younger age group. So we look at the ages of the patients as we get there, as they come to us.
Yeah. So, yeah, it's good that Doc Lyra mentioned clarifying what kind of single woman, because there can be a single parent, single woman who's never had sexual intercourse, single woman who has several partners. So
Yeah,
we
yeah.
have to be clear about it. But thank you, Doc Lyra, for sharing. In terms of, people have that mindset, oh, maybe I'm more predisposed to cancer and all that. We know health is also not just physical, right? There's we look at it in a holistic perspective. So there's the mental, emotional, spiritual, relational. So it's not just, of course, diet is a big factor. It's not just that. Of course, if you have other issues that need to be dealt with, it also affects your reproductive system. So, ayan. Looking back, Kyla, would you have preferred to do an invasive checkup, or
Um,
would you have done a different way, of checking
I
yourself? I
think
mean,
the question is more of because invasive in terms of doing the DNC or
Yeah.
hysteroscopy very early at 22 years old. Um because my doctors were telling me, my OB was telling me, if we do an invasive, your hymen will be broken. So at that time, since I was single, so we were also contemplating on that part. But I think if I would answer the question, if into a more into a perspective, if we could have done the hysteroscopy earlier of the year of 2021, I would say yes on that part. However, if like what I said, if the other people here who knows my story, I was also dealing with other medical health conditions back then. Before me really looking into this reproductive health issue during the course of 2020 towards 2021, I actually went through another deep complicated surgery in my tonsillectomy. So that was a complicated tonsillectomy, so I had to go through that first, and then I went back to this to my reproductive health issue. But during the course of from 2016 towards 2021, I did not stop to go back and forth to my OBGYN. But because during the course of that of those years, I had to deal with another surgery. So I feel like we have to take one step at a time. We can't, we can't make two in one surgeries. So I had to deal with the other surgery, which is also a question mark for cancer at that time, but thankfully that was benign. So but this time around it wasn't benign. So the question, if I could have done things earlier on the year of 2021, I would say yes on that part.
yeah. So, Kyla, of course, what you're sharing is based on what you've learned that others can also apply. The sooner you confront what you're going through, the more that you can address it at that point. But I'm not saying it doesn't mean. I mean, of course, it doesn't mean that you will not go through any more troubles, right? I'm not saying that you'll be exempt from that, but what Kyla's saying is, of course, when you go through more intentional uh, monitoring in screening and all those tests mentioned, that of course you'll see how it can be addressed right away. Yeah. So there, thank you. And we have Cecilia B asking here, what is vaginitis? If left untreated, can it lead to cancer? Doc Lyra. Doc Lyra, you're on mute, I think. Yes. Still no audio.
I think there you go. Yeah, vaginitis is infection of the lining of the vagina. It does not lead to cancer, but it is treated with antibiotics and vaginal suppositories. I think that should answer the question. It does not lead to cancer.
Doesn't it? Yes. Okay. That's very straightforward. Thank you, Cecilia. Yeah, our next question from Portia Alamares to Dr. Lear. Is pap smear necessary if one has menopause and has not and does not have sex or has not had sex for several years? Is it still an annual thing?
I think the pap smear should be done annually, every year. But the protocol. Okay, let's use the word protocol. The protocol these days is that after three pap smears that have been normal, then the postmenopausal woman could already just have it every 3 years. So, but then with my patients, I still tell them to please come see me every year, because sometimes during those 3 years, things could still happen. And we get surprises when they come back after 3 years of not having seen me. So I would still say yes, they should still see the doctor every year.
Yes. Okay. So no exception to the rule, whether you're going through that or not. Okay. Doesn't the vaccine, I don't know which vaccine they're talking about, but maybe you talked about Dr. Lear kanina, the HPV vaccine, which is
Yeah,
necessary for all.
HPV. Oh,
Does this have negative effects, overall side effects, effect to the reproductive system that will prevent uh,
yeah, yeah.
something? I mean, of course, it should prevent cervical cancer, but can cause, sorry,
Yes, yes.
yeah.
Yeah. Vaccines generally are not supposed to have overall negative effects. You could have the acute or the symptoms like pain in the injection site. Some vaccines, like the flu vaccine, could give you some mild flu-like symptoms. The HPV vaccine usually would not have any immediate effects except for the pain in the injection site. Some women who are allergic to some substances in the vaccine, like egg yolk or something like peanut oil, could develop allergic reactions to the vaccine. That's why, again, the history taking should be that does the woman or does the patient have allergies? So yes, vaccines should be are supposed to be relatively safe, and they are supposed to protect the patient against the infection, the viral infection that it is designed for. Um, well, in the drug in the precautions, there are some things there that are written, but these are very rare side effects and consequences of the vaccine. So generally, they are safe overall.
Okay, thank you, Dr. for that assurance. Yeah. Next question. Is there something good you can find in your present condition, Kyla?
I think one good thing that I can find or learn from my present condition is, one, I get myself be dependent more to God with my life, because when dealing with cancer, you're also thinking about death, but however, if you're with God, somehow your heart has this peace that you can just still through with life or move forward with life, even though there's still the presence of cancer, there's still the presence of you have to monitor, even if cancer is already finished. Um however one another good thing is, God is molding your heart to understand what pain and suffering is about. It's not because it's a punishment for you, but it's more of learning how to go through it with a good perspective of God, in a sense that because you have God, you can go through the valleys of the shadow of death. So I think that will be my answer, is it's more of dependence of God, and you have a new perspective already with pain and suffering. So before, if I would complain a lot, now I learn not to really complain, because I have that new perspective already of what God is and what He is doing in the midst of pain and suffering, and He understands what I'm going through right now.
Thank you, Kyla. Yeah. Kyla is turning her pain into praising God. Yeah. So we have a question here from Wilfrida Narciso. How is the right way to ask permission to change an attending doctor? Ayan. Doc Lyra, what if di na nila feel yung current doctor? How do you say that you're moving to another one? Of course, there must be honest, open communication. But how? Maybe an
Okay,
example
yeah,
of how you would
yeah.
tell your
That's a
doctor
very,
that you don't.
very good question. Because some patients would really be hesitant to tell their doctor that they want to change doctors. I think that the best way would be to just honestly tell your doctor, may I have a second opinion? And that doctor should not be offended that the patient wants a second opinion or even a third opinion, because that is the patient's right. The patients do have the rights to seek second or third opinions. So that, I think that's the best way to do it. And of course, if I'm the first doctor, the patient asks for a second, asks permission to have a second opinion, and that patient does not come back to me, then I would already know that she has gone to that second doctor for the management of the case. But the doctor should not really get offended in that in any with any of those requests. Those are your rights as patients. Just be honest with your doctor.
Yes, yes, there's a way to share it lovingly and graciously. So there's a feedback here, comment from Jane Antonio. Praise God for favorable response of Kyla's body to immunotherapy. God is working nonstop, strengthening her faith and using her to share Jesus to many people in her journey. Thank you so much, Kyla. God bless you more mightily. Yes, thank you, Jane, for encouraging Kyla, and we know that she needs encouragement, just like all of us that we're going through. Yeah, so to wrap up, of course, I know there are other questions, but in the interest of our time here, limited time in our broadcast, of course, Doc Lira, if they want to consult with you, how do they go about that? Yeah, and we'll give more details later. But uh, to end our broadcast, I would like to ask Kyla, after all that you've gone through, what advice or encouragement can you give to those who are watching right now?
Before I'll say my answer to that question, I just wanted to quickly add, with the answer of my question earlier, if I had done things earlier, or if I really was pushing my doctor that now let's do the hysteroscopy. Will I not have cancer? That was actually my question all throughout. But I think even though I had done things earlier, or my doctor had done the hysteroscopy earlier, I will still have cancer. If God had really planned it in my life, He will still do what He plans, even though things were done earlier. So I just wanted to add that up. So to wrap up, I want to say three things. One, it is essential for women upon reaching a certain age. I believe it is beginning 35 years old. So Dr. Lyra can clarify on this, to have a regular checkups such as mammograms, breast ultrasounds, pap smears with an OBGYN, even if you do not have symptoms. Those experiencing something unusual, or even nothing unusual, but you just have to go to an OBGYN. So including youth such as spotting or sudden weight gain or loss should not hesitate to have themselves checked by their OBGYN. Early cancer detection is always better, as it gives one a fighting chance. Second, do not be afraid to go to doctors. Sometimes there is the fear of undergoing medical procedures that may be painful, or fear of inability to afford the cost of the treatment. But we have a God who is able. He will provide you the strength and your needs. Remember that He promised that He will never leave us. Third, be proactive in asking your doctor questions and get them to discuss every aspect of your condition. You need to understand fully what you need to do, and when you need to do it, to avoid risk in your health condition.
Yes, thank you for your honest sharing, Kyla. And just to summarize, your top lessons that you've learned along the way, and thank you for sharing with us as we wrap up. Yeah, Kyla, the top
Sorry.
lessons
Top
you
lesson.
learned
Sorry,
about
sorry.
life. Yeah, about life,
Major,
about
sorry.
God. Yeah, no problem.
Sorry, I went through a blank at that time. So, top lesson. So I have learned that God has a purpose for our lives. He is in control. We will never know or understand many things, but we can entrust them to God, because He wants only the best for us. God allows trials to mold our character and to learn to trust Him more. Going through the Glorious Hope recovery program before I discovered I had cancer helped me to prepare mentally, emotionally, and spiritually. It enabled me to process what I was going through in the light of God's design. So, in everything we experience, the good and the bad, God has a purpose. If we recognize this, we can give thanks for everything. And last but not the least, my devotionals, such as reading in the Bible, of how Jesus healed the bleeding woman simply because of her faith. She just touched Jesus' robe, gave me hope that soon enough, like her, I will be healed, even though it has been 1.5 years already. My experience has also encouraged me to promote awareness among women about taking care of their reproductive health. As a member of various cancer care groups, I am always conscious of two things: raising awareness about cancer and giving hope to cancer patients by praying for them and sharing with them the hope we have in Jesus. Thank you.
Thank you, Kyla. Indeed, you're focused on the Lord and His purpose for you. So inspiring. Doc Lira, of course, we know prevention is better than cure. Although, of course, not all the time people follow this. But what would be your last words or pieces of advice to the people here who are listening, not just to the women but also to the men who are listening. Of course, only the women have the reproductive health, but the men have a role in supporting their wives or the
Oh
parents
yeah,
supporting.
yes, yes, yes. Uh,
uh,
I usually like to see that the patient, the woman comes in, and the husband comes in with her. The husband also would all some husbands would request that they be with their wives when their wives go into labor, and I admire this with them, But in my hospital, they're not allowed in the labor room, but they are allowed in the delivery room when the baby is already ready to come out. And the husbands who have been with their wives during delivery, they become better husbands because they now realize how difficult it is to undergo delivery and childbirth. So therefore, yes, and of course, the husbands or partners who come in with their wives during the gynecologic exam, they are there when I explain to the woman. The husbands also listen, and they are able to understand why the wife is undergoing these things. So really, the husband should really be with the wives during these times in her during her problems with her reproductive system, so that they will also understand why. They will know what to do. And well, minsan with the pregnant women, I just tell them, husband, ikaw ang magmasahe ng likod ng wife mo if she complains of back pains, things like those. No, they could participate in the continuing care of their wives. So my advice really is that be partners with your wives, men and women. Be careful also to go regularly to look or try to know a doctor whom you could trust and whom you could rely on to explain, so that you will be comfortable to go see her for anything that you have. And also somebody who will be there when you need her or when you need him. Like if you're bleeding and you want to know what to do, then you can text her, you can call her. And then of course somebody who spends time with you to explain what you're going through. Those are the doctors whom you should look for and stick with, so that your health journey will be very good as you grow older. In fact, even I tell my patients, kahit hindi ka na nagbubuntis, even if you're still not having prenatal checkups anymore, please continue to come see me, so that we can see you through up to your menopause and even up to the postmenopausal years. I also take care of a lot of menopausal women, postmenopausal women, women who are undergoing the perimenopause. These are the women who really are miserable because of the symptoms of the menopause. And these are the women who really need to see their doctors because they are now aging and they could already be at risk for a lot of the cancers that we have been talking about.
Yes, there you go. And speaking of getting in touch with a doctor you can trust and who will journey you, that's Doc Lyra, among, of course, other doctors. Doc Lyra can accommodate you. Just message her. She's willing to give her mobile here, 0917-525-0058. But please message her first, your name, and perhaps if you're watching this
How?
broadcast, that how you
Yeah, yeah,
got to know her through Life to the Max or something else. But or if you want to refer other friends as well. Yeah. So Doc
yeah,
Lyra is willing to accommodate, but don't call her at
yeah.
3 a.m.
Yeah. Yeah. Please text me first because
Yes,
I
yes.
want to know why you want to see me. I want to
Oh,
know how soon you have to
yeah,
be seen. Because
yeah,
if you go to my secretary right away, she might
yeah.
schedule you for the next month pa. Now, if you
Oh
need to be
no.
seen already, I could always tell the secretary, please accommodate this patient tomorrow
Yes,
or
of
during our next
course.
clinic. Or so when
Yes.
you text me, please text. Don't call. I don't answer calls from unknown cell phones.
Number.
So just text me, tell me your full name, tell me why you want to see me, and then I will give you the name of my secretary
Yes, for a schedule,
and
and
number.
that's good.
Yeah.
That's how caring Doc Lyra is. She wants to know how urgent you need to see her. Yeah.
Yeah, right,
Yes,
right.
thank you. And Kyla, you wanted to add before we end?
I just wanted to add and encourage women who were listening. This is also what I did when I was going through my cancer. I signed up to be a member of various uterine and endometrial groups, or reproductive women's reproductive health groups, where women across share their experiences. And then why do I encourage women to be a member of that? So that when you have questions that you don't know what to do, or you don't know where to go, or what doctor should you go to, you can ask other women who are experiencing the same symptoms as you are. That really helped me a lot. That gave me discernment of what to do, or what proactive actions that I should do towards getting a needed medical action for, for my case. So please, women, don't hesitate to ask other women who are suffering, or who are experiencing the same symptoms as you as well. So that's all.
Yeah. Thank
Thank
you,
you.
Kyla. And Kyla, you have a Facebook page, right?
Yes, I
Why
do
don't you
have a
share with
Facebook
them?
page. So thank you for that, Ate Riva. So you can like and subscribe, or follow, like, and subscribe at Kyla Fights Cancer. So KYLA Fights Cancer. On my Facebook, I share stories, experiences, and various things to educate and help other women as well. So yeah, so
Yeah.
do follow me and we'll communicate there. Thank you.
Thank you, Doc Lyra. Thank you, Kyla, for
You're most
sharing with.
welcome. I enjoyed the session. Kyla, you've been an inspiration to everybody.
Thank you.
Yes. Continue on fighting the good fight and running this race well by God's grace. Thank you, Doc Lyra, also for being so willing to share your expertise with that. Okay, so we'll go now to the last part of our program. We have our thank you. Thank you to our guests, Kyla and Doc Lyra. So yeah, we are here, the last part of our program, and I'm so encouraged listening to Doc Lyra and Kyla. Really, this is a program that the Lord has made for us to share with others. So, our friends and fellow Life Maxers, why don't we share this video with our other friends and family members as well? So, to all women, of course, I'm a woman too. Let's take care of our female. Uh, our reproductive health. That's us. And being good stewards of the body God has entrusted to us. And if we feel something strange, let's not take it lightly. Or even when we're not feeling anything, let's go for a regular checkup. Just like, of course, in our walk with God, we know it's not an occasional checkup. We need a daily heart check. We need a daily check of how we're living, if we are living according to God's design or not. So yes, the regularity of the checkup for us women matters, and of course, we know that this is something that is part of what the Lord wants us to do in stewarding our body. So, to the men listening here, take good care of the women in your life. And of course, if you're a single woman and you're living with your parents or relatives, whomever it is you're with, the point is to support one another, encourage each other to confront the things that the Lord wants us to confront, and not let it be set aside and next time na lang, no? But we're not promised a next time. The Lord wants us to obey with joy and gladness without any delay. So let us never forget how the Lord works, whether in sickness or in good health. God is the one who made us. He knows our bodies. He knows how to restore it. He knows also what to do with it when it's not in its right condition. And through it all, the Lord never fails to be faithful. So, yes, we continue to trust God regardless of what season we're in. And we thank you that you are here to join us today. So if you're not yet following us on social media, we have our channel CCF Life to the Max on Facebook, Instagram, and YouTube. And we also have CCF Feliz on Facebook, Instagram, and YouTube in case you want to log on to those channels. And of course, we have our next broadcast on October 23, 10 a.m. Manila time. Remember, our live broadcasts are every second and fourth Monday of the month. But like I said, you may watch on demand. Thank God for that technology and availability. And very important for us to provide a safe space for sharing your experiences, learnings, even your prayer points. So we invite you to join our Zoom discussions. Details are on the screen. That your passcode, meeting ID. Make sure you log in with your real name, not your iPhone's name, so we can let you in, or not your Android's name. So if it's your first time to attend, join room number one. We have a room especially for you. And if someone invited you, you may look for that person's name, that breakout room, who can accommodate you and who can help you join in the discussion. So to our regular attendees, special acknowledgement to the Eastern Police District. Please stand by for our discussion guide and breakout room after this broadcast. If you are here today watching us from wherever you're logging in from, thank you for being with us. And finally, if you are called to serve here in Life to the Max, we are inviting you to join our team of volunteers. We have a need for backroom, tech, creative team, speaker, care leads, care assistant, social media management, and copywriter. All you have to do is reach out to us. We are one click away, or message us on our channels. And if you'd like to be prayed for, if you need that courage to join, just call us. No, not call us. Message us on our social media channels. So there, thank you so much. Watch out for our discussion questions after this. And we truly praise and thank God for you being here with us. I'm so honored to be serving with all of our volunteers here in Life at the Max. I'm Riva Galasan, your host. To God be all the glory. See you in 2 weeks, God willing. Thank you.